We've also worked with Columbia Children's Environmental Health Center to really begin to understand and document environmental exposures of community residents. When we were organizing around the North River Sewage Treatment Plant, one of the key demands from the community was to better understand what they were being exposed to. They wanted health studies. And so we reached out to Harlem Hospital and to Columbia to begin to work with researchers and begin to develop research so that we could better understand those exposures. We were able to begin working with Dr. Joe Graziano, who headed an NIEHS, that's the National Institute of Environmental Health Sciences. They funded basic research centers around the country. And so there's one funded at Columbia to look at environmental health in northern Manhattan. So we first began working with researchers there to conduct community-based research with our youth group, which was called the Earth Crew. And we were able to get some small pilot grants from that center to look at diesel exhaust exposure among adolescents going to school in this community, and to develop air monitoring studies so that we could understand the level of fine particles that people were breathing in as they walked along our community streets. We've been able to use that information to really better understand what children were being exposed to. In one study, we found that 75% of the 7th graders who were involved in our research study had reduced lung function, even when they went to schools that were not on heavily trafficked streets. We have been able to publish in peer-reviewed journals that research and educate our young people who were able to do the traffic counts at intersections and interview other students as to time activity, time activity tests to understand where they were spending their time in the community so we could better understand their exposure. And we were able to use some of the monitoring data at intersections to better testify when the EPA was developing stronger fine particle standards. We were also able to, through that activism, to get the EPA Region 2 to come into this community and to conduct their own air monitoring, which then they used the results of to help develop the fine particulate standard that had to be upheld by the Supreme Court just a few years ago. And that policy came out of the last days of the Clinton administration. And Carol Browner, the EPA administrator at that time, said that she thought that was the strongest public health benefit that her administration was able to bring to this nation. We know that out of the cohort of 730 mothers and newborns that the center has been following over the last 10 years, that over a third of them have had negative outcomes in terms of birth weight, body size, developmental delays, which lead to problems in learning in school. We also know that there's been some genetic alteration due to pesticide exposure and exposure to fine particles in diesel, PAHs, they're called. We also at the same time know that this nation has declared a war on health disparities, and the Surgeon General, administration after administration, has had a goal of reducing health disparities. And we have not been able to do that yet. And I believe that a key part of that puzzle is the environmental exposures from chemicals, from air quality, and other toxins. Much of our role as a community partner at the Columbia Children's Environmental Health Center is to translate that research into policy and practice. You know, one thing you realize is that it doesn't change policy just to have a researcher conduct a study and publish it in a journal that most policymakers aren't reading. And so our role, and I think we've been very effective at that, has been to take that research, organize public campaigns around it, use it for testimony at the city council or the state legislature and Congress to really drive policy change and the way we do business in our regulatory agencies.